If you've ever felt like your heart has skipped a beat, or maybe it felt like it was going to beat right out of your chest, you should probably talk to your doctor. You could have something called atrial fibrillation, or AFib for short. Dr. Nitin Kulkarni is here with Texas Health Heart and Vascular Specialist Group, and he joins me to explain exactly what this means. Good morning, doctor. It's so good to have you with us.
Good morning. Thank you for having me here.
Yeah, so atrial fibrillation is something that I think a lot of us are familiar with. I know a couple people who have it, but I don't think that we necessarily know what it means. Can you break it down?
Absolutely. So AFib, first of all, is a fairly common condition. It affects around 3 to 6 million Americans. And studies have suggested that the lifetime risk of developing AFib is anywhere between 1 in 5 to 1 in 4 Americans are going to develop AFib at some point in their lives.
I didn't realize it was that common.
It's going to become even more common as we get older. So exactly what is AFib? So here on this graphic here, I just want to kind of walk your audience through. So the way the heart works, there are 2 top chambers and then 2 bottom chambers. The top chambers are the receiving chambers, and they pump the blood to the bottom chambers, which then pump the blood to the rest of the body. So the heart has a cardiac conduction system, and how that normally works is there's an electrical signal here in this diagram, which originates from the top left chamber of the heart, and then that propagates and hits what I call I-35, which is the main electrical highway down those bottom 2 pumping chambers. In atrial fibrillation, instead of having that one nice electrical signal, the top chambers are actually beating at 300 to 400 beats per minute. And that's bombarding that I-35. And that results in 2 big issues. One is the top chamber, instead of squeezing nicely, it's squeezing like a bag of worms, and blood clots could form and fly off and cause a stroke. And the other situation is that it can bombard that I-35, can lead to really rapid heart rates at times.
I love that you named it I-35. So what do patients say it feels like, and what causes it?
So patients can have a variety of symptoms. Some patients are extremely symptomatic, and so they know when they're going in and out of AFib. Symptoms include palpitations, chest pain, shortness of breath, maybe lightheadedness. Some people have a fairly insidious set of symptoms. They may just feel they're more tired or fatigued. And some patients, unbelievably, are completely asymptomatic. They have no clue that they're going in and out of atrial fibrillation. And regarding causes, the strongest risk factor is aging. So 10% of individuals above the age of 80 suffer from atrial fibrillation. But other risk factors that predispose people to develop AFib at an earlier age include high blood pressure, diabetes, smoking, obesity, and one risk factor that's often overlooked is alcohol consumption, and that increases the heart's risk to develop AFib.
Interesting. So, like you were saying, it's pretty common. How dangerous is it?
If there is one thing that your audience takes away from today, it's the risk of stroke that's associated with AFib. So AFib causes about 20% of strokes in our country.
Wow.
The strokes caused by AFib are fairly large and debilitating and have higher rates of death. But the good news is that we have really effective medications that can drastically reduce the stroke risk. So it's really important that anybody who has AFib has spoken to their physician to have this stroke risk assessment and to see if blood thinners are actually right for them.
You just told me a whole lot of information that I never knew. So the treatments, you said there's medicine. What are the treatments?
So, so depending upon what the patient's symptoms are, their comorbidities, and how long they've had AFib, treatment options include medications. In addition to blood thinners, we prescribe medications to either to slow the heart rate down or to keep the heart in normal rhythm. We might recommend a procedure called a cardioversion. And so this is an outpatient procedure where paddles are applied to the chest and electricity is applied through those to reset the heart into normal rhythm. Or you may even, patients may be recommended to undergo what's called a catheter ablation. And that's a minimally invasive procedure where we put catheters through the leg, go into the heart, and we zap the triggers that tends to cause AFib.
What about lifestyle changes? Does it make a difference?
Absolutely. So what I tell folks is that aging is the strongest risk factor, but it's better than the alternative. So you fix what you can fix. And so things that I tell folks are, number 1, weight loss. If you can lose at least 10% of your body weight, that makes a huge difference.
Okay, weight loss.
If you have AFib, to undergo a sleep study to be screened for sleep apnea, and reduction or cessation of alcohol consumption. So unfortunately, we used to think that mild to moderate alcohol consumption was okay for AFib, but recent studies have suggested that any alcohol might be too much alcohol. So what I tell folks is that if you're going to drink, wine is better than beer or liquor, and if you're going to drink, try to keep it less than 7 drinks a week. The good news is that caffeine or coffee has not been associated with increased AFib risk, so we can all enjoy our non-fat, skim milk pumpkin spice lattes this summer, or this fall.
This is so interesting. I just learned a whole ton of information. I bet you did too. Thank you so much. Appreciate your time.
Thank you for having me. Really appreciate it.
For more information, call the number on your screen, 866-931-6018, or visit thpg.org/AFib.